I think we all can agree that healthcare costs are out of control, and we aren't any healthier as a nation despite the spending. Some might even say that the healthcare system needs to be transformed. That's exactly why we created Innovation Health. We start with the member. We want what you want, a system that's easy to navigate, has predictable costs, and helps you stay healthy. To support members, we start with the relationship between the healthcare providers and the insurers. We're allies focused on the same goal, you. Let's take a closer look. Care management is what happens when insurance stops being about claims processing and starts being about restoring a member to health. Your Innovation Health membership means that when your healthcare needs stray from routine physician visits and flu shots, we'll step in with what we like to call help care. Help care is something Innovation Health is uniquely able to offer. It begins where most other health insurance companies stop. That's because we have the relationships with healthcare providers and technology to make help care happen. How? We start by viewing Innovation Health members using proprietary technology. We group members to help us understand who may need our help. When you're dealing with complex health issues, you will need help care. Because unless you're an expert in medicine, insurance, and understand all the services available, there's a good chance there's some sort of gap in your care. So we've hired experienced professionals for you, an Innovation Health Nurse Concierge. The Nurse Concierge reviews the health records of members who may need extra help from a professional. It takes the training and careful eye of the Nurse Concierge to look at electronic health records and claims for each member and find actionable insights. The Nurse Concierge reviews the records of members who are showing signs of distress, like multiple visits to the ER or multiple prescriptions. Here's an example. Meet Sanford. Sanford has high cholesterol and an increased chance of having early-onset cardiovascular disease. His in-network cardiologist prescribed a drug for high cholesterol that cost him $200 out of pocket for every refill. That hurt, especially since it's a drug he has to take indefinitely. Luckily, Sanford received a call from the Innovation Health Nurse Concierge. The nurse worked with Sanford's doctor to find a prescription for high cholesterol that only costs $10 per refill. That saves him $2,280 per year. And then there are times we have to take it to a whole new level. Sometimes you need more than a nurse concierge. When your needs are so great and so complex, the nurse concierge accesses a multidisciplinary group of healthcare professionals, including a medical director, pharmacist, case managers, social workers, and other specialists. Together with the nurse concierge, this team can assist members in getting the care they need. Along with needing the most help, the sickest of our members represent 60% of the cost, with some portion of that being impactable, meaning if we take better care of them, costs will go down as well. Those savings are passed along to members like you. Technology is embedded into the Innovation Health business model. Some of it's obvious to you, and some of it's behind the scenes entirely. We're here to help you navigate the system, whether you're enrolling, finding a doctor, or working through a health crisis. We use sophisticated systems to spot gaps in care. Then we'll proactively reach out to you to help. We built an integrated information delivery system designed to provide a complete picture of every patient's care. Consequently, you'll see fewer folders going from doctor to doctor and a lot fewer repetitive tests. That way, you have less to navigate in the first place. For those of you who carefully manage your healthcare expenses, you can compare costs of doctor office visits, surgeries, diagnostic tests, and procedures at different locations or facilities before you go. For instance, an MRI within a 5-mile radius of your referring doctor can vary $300 to $1,200 for the same service. Also, Innovation Health breaks down access barriers with smart solutions. For example, there is a shortage of behavioral health providers nationwide, and we know behavioral health issues impact our community in particular. In Virginia, more than 230,000 adults, roughly 3.8% of the population, have experienced a serious mental illness. So we offer telepsychiatry. You can receive counseling using televideo, accessing a trained clinician or psychiatrist in the privacy, comfort, and convenience of your own home. All you need is an email address, high-speed internet, and a webcam. That's technology put to good use. Network for Innovation Health is both local to Northern Virginia and national. We tap into Aetna's broad national network. If you travel, you'll have access to in-network doctors. Likewise, for those of you who live outside Northern Virginia, you too can have access to in-network doctors just about anywhere in the United States. We tap into high-quality, clinically integrated networks of doctors and hospitals in Northern Virginia who work together to provide high-quality clinical services. Clinical integration means that independent doctors share a common database of patient records. Specialists can benefit from primary care providers' insights and vice versa. A clinically integrated network offers you the very highest level of ease and the lowest out-of-pocket costs. By the way, these are some of the best doctors, hospitals, and providers in the country. In summary, we're here to help get and keep you healthy, provide high-quality, lower-cost care, and build a healthcare delivery system for you. Thank you.